We shall now go on to our next speaker, Dr. Harshit Vaidya, who's a consultant vitreous retina surgeon at Dr. Vaidya Hospital, and it's a family practice. And I think is the right person who's going to talk to us about integrating into a family practice. And Dr. Rishi Swaroop would be asked some questions on this once this talk gets concluded.
Thank you, ma'am. Thank you for the introduction. It is every parent's dream to see their child succeed. And I'm sure it is a doctor's dream to see their child someday join them in their practice and carry forward their legacy. Our story is no different. I joined my father's practice a couple of years ago, and the journey has been nothing short of an exciting and exhilarating journey, which has taught me a lot in these 2 years, and the experience has been amazing so far. All throughout my education, however, I was told and made to believe that my life is going to be a cakewalk, and all I need to do is study and get back into practice. And nothing could be further away from the truth. I acknowledge that I come from a privileged background. Having a setup is a privilege in today's era. But there are certain nuances, there are certain points, there are certain issues which are integral to the family practice. And
your slides are not moving, but I think you're still in the introduction, no?
Yes, ma'am. And today I wish to address a few of my own experiences. Is it moving now, ma'am?
No.
I'm trying to move, ma'am. It's okay. Yeah. So can you see now, ma'am?
Yes.
Yeah. Okay. So what do we get when we join our parents' private practice? We get a place to practice. Well, in a city like Bombay, that is an amazing thing to have. Financial flexibility, an existing patient base, and an understanding of the private practice, which is slightly better as opposed to our peers who are starting out all by themselves. However, what we do not get is the skill and knowledge that we need to acquire, the respect and recognition that we need to earn. And we need to realize these are not our patients. These are patients our parents, our previous generation has accumulated over all these years. It's their hard work that has been given to us, and it is our responsibility to ensure that we take care of the patients the way they did. And at the end, there is an issue of the credit, in that we'll always be told by someone or the other that you are here only because your parents did this for you. So these are certain issues that you deal with. Coming to the certain challenges which we faced in the past 2 years, and I thought of addressing just a few of them so that we have a better understanding of how a family practice would be. So once we started working, we realized that our differences of opinion could range on a vast array of topics. It could range from patient care to finances to day-to-day functioning of our hospital. Well, this could make you feel unheard at your own place. Your parents could feel that the child is not doing enough, or he's inexperienced and he doesn't have that acumen just yet. Well, for that, I think communication is the key. As cliched as it may sound, this is a small practice that we started a few months ago to ensure that our communication is smooth. We ensure that every week we have a 30-minute conversation purely for our work. This ensures that both of us can hear each other's opinions. This ensures that we are both on the same page for our progress of the hospital. The second issue that we face commonly in practices which are family run are resistance to change. Well, our practice has been running great so far for the past 30 years. Why do we need to change anything? Well, a pushback like this is fairly common when we see, especially in family-run practices, because things have been going on smoothly all this while, and newer approaches or changes in the existing pattern are dealt with such a pushback. What we've realized is leading by example and giving evidence of why a particular change works is a good way to go forward. For instance, we've had our electronic medical records in our hospital installed for over 10 years. And for the past 8 years, they've not been in use. So when I joined back a couple of years ago, it took me a good 3 to 6 months to ensure that we changed from our typical prescription giving to an EMR software. So a slight persistence by explaining that why a particular change will be good for our organization is an essential tool to understand and allay these fears. Secondly, having an external counsel or an advisor for some major decisions can allay a lot of problems, in that a third party unbiased view helps us in solving major issues. The third aspect could be of acceptability. Certain times patients are not willing to be examined by a junior and somebody who's just come out of his education. Your staff may not be willing to accept the orders that you give. And the naysayers will tell that you're here because of your privilege and that you haven't earned your right just yet. Well, it has to be a patient game. This is a long-term game. What we need to realize is we need to build rapport and be empathetic towards our patients. We need to realize that these patients have been following up with a particular doctor, which is your parent in this case, 10, 20, or 30 years. It is not easy for them to shift over to just a junior who's just joined. In this case, in situations like this, it is important that we are available and give time to our patients. Initially, in the first few months, whenever my dad's patients would join in, I would refer him back to them. But over the past few months and years, what I have done is I see those patients just as anybody else in a postgraduate program would. What this did is it builds a rapport between me and the patient. It generates a trust. And then these patients eventually don't mind seeing you all by themselves. The fourth evil, which percolates in family-run practices, is an unstructured governance. And how can you blame anybody? It is usually a one-man show in which a single person takes care from administration to insurance to OT to taxation and everything around. So when we come from higher institutions, it is our responsibility to ensure that some standard operating procedures are set in play. This ensures a smooth functioning of the organization. It is essential that we define our roles, may it be our spouse that we're working with or our parent. What this does is it ensures that the micromanagement reduces. It also reduces the duplication of work that may happen. Having a financial clarity from the get-go is a good idea to begin with. Knowing your financial responsibility for your organization, as well as your financial compensation from the organization, also allays a lot of issues that can probably happen in the future. And knowing that we should not be taking the work back to the dinner table. This is a small yet important aspect of keeping our financial, our work and our life and our balanced. So here I would like to give 4 key take-home messages. Here we need to realize that always we should have our communication channels open. In case we need to bring about a change in our organization, we should lead by example and seek external advice whenever needed. In case of our patients are unwilling to see us initially, we need to be patient, we need to be humble, and we need to be empathetic. And last but not the least, we should define our roles clearly and have a financial clarity to ensure that our future is in place. Thank you.
That was a wonderful talk. 1 minute, just 1 minute. That was a wonderful talk. You covered it all, but I also do understand that there are a lot more challenges which you have not discussed. Rishi, I'm going to ask you them. Like, how would you, like he beautifully tried to bring it out, how would you benchmark yourself to the next level? How do you separate the personal and professional relationship? And do you feel that there has to be a constant redefining, a redesigning, which has to be there, or could you hold on to the core values and make some changes as it goes along the way?
First of all, I must congratulate Vaidya. Very nice talk. You covered all the key points, and it took me down my journey when I joined my father more than a decade ago. It's like everything coming back to me. So, very nicely done. And coming to ma'am's question, you talked about values. I think any practice is identified by its values. And if it has been successful, it is because of these values. So I think one shouldn't tinker largely with them. But of course, you have to change with the times. So maybe some things have to change for the better. But the core value remains the same because that's what has worked. So I don't think you should disrupt too much. Maybe gradual, gentle changes depending on your personal ideology and how with the rest of the family it gels. You can discuss together and make changes. But essentially, I think at least in my case, I'm essentially following my father's mold and he's following his father's mold, but in a slightly different way. So
yes, I do know. You're doing a great.
What was the other question again, ma'am?
No, you said about redesigning and redefining, which happens in a subtle way.
Yes.
But how would you benchmark yourself? How would you you believe that you are in a family practice, you have to take it to a different level. So
Yes.
what is the ideology about going towards it? How would you?
So it's a very difficult thing actually, because it's Abhishek Bachchan versus Amitabh Bachchan story all over again. I'm sure anybody who's joined his father's practice will identify with that thing. And initially it's very difficult actually. And like Vaidya mentioned, everybody wants to see you and then go and show the main Bade Doc Saab. And it hurts your ego, because you know you're good at your job and you have told whatever is there, and there's nothing extra that your father or mother or anybody is going to say. But you come to realize that it's not just about the patient care, it's also about the trust. So you have to earn their trust. So of course you have to, that has to be the benchmark, but you have to raise the bar. And if you're good in your work, automatically that will happen. And then you have to set benchmarks for every year. Okay, now we are here, next this is something new we have to do together. And I think it was very nicely put by Vaidya. Communication is the key to avoid friction and to progressively grow forward.
Yes, it's Rishi, you spoke well, and of course Harshit did a great job of it. So there is a lot which could be discussed. Actually, this could have been kept as one session, and we could have discussed it very well. But anyway, this is just an eye opener about the amount of talent which we have amongst us.
I'll just add one more point to what I said.
Yes.
You also, not just you have to earn the trust of your patients that you're as good as your father or whoever was the primary practitioner. You also have to earn the trust of the primary practitioner.
Yes.
That you are capable of running the practice.
Yes.
And you are capable of doing a good job for his or her patients.
Yes.
For me,
I'd like to add one thing.
Yeah. Yes, sir. Yes.
Rishi, I think apart from the the generation which are going to attach to their parents, it is the responsibility, duty of parents also to give a space to their younger generation, give some sort of support and the confidence to be given, and the little independency has to be given. I've seen many young people being a very bright. They are under the shadow of their parents for a lifelong, and they never come out. It's because that balance is not there. So there's a responsibility. Chitra is sitting here; she can answer this question. How would they should manage to their kids joining them? It is very important.
Very important. It is very important. I think it does very well if the next generation, they have seen their parents struggle and work hard. And so, good majority of these children are actually the model youngsters who join the practice, who have constantly respect their parent and know the kind of work. They have seen it in their 25 years of their evolution or 30 years. So they would do their best to take it forward. It's just a give and take, and it blends beautifully. And I don't think, and I know Rishi and Harshit are the right examples, and so has Shreyas been in our practice.
Can I just make a quick comment?
Yes.
Actually, I am also a second generation ophthalmologist. My mother-in-law was there for 25 years before I joined. So I just want to say one thing is that understanding between you and the parent has to be very, very good. At the same time, we need to acknowledge that what we are getting on a platter. Yes, I totally correlate with what he said, that I have heard many times that you have got things on a platter. The question is from how you raise it from that thing, whatever you have is all up to us. So we need not keep feeling that guilt and this thing that we have got something on a platter and we need to prove something to anybody. We don't need to prove. If you just need to be on your own and be good, you can develop your own relationship with the patient. So that itself will bloom over the years. And one thing what maybe the parent or the other person, spouse or whatever could do is keep different timings and refer the patient to each other. So then, that itself becomes the trust that the parent shows in the child, or you should not call it a child anymore, to the new entrant. I think that trust, that patient himself will feel that, yes, he is showing that trust. So that is one way how we can.
I think it's all about mutual respect, and I still see Anaga respecting her mother-in-law and acknowledging her at every turning point. And I think that augurs for the blessings which comes